Hi everyone, my name is Hina Mazharuddin. I'm a PA that's been practicing now for 11 years. I currently practice in obesity medicine along with telemedicine. So I've been fortunate enough to work with some of you VIPs as your mentor for telemedicine. If you're my student, you know that that's what I call you, VIPs, virtual internet provider students, because you students are amazing. So I received a request to make a video for you to show you how I do my abdominal exam. So I thought we could kind of talk through it and hopefully it'll be of some help and use to you. So just a quick reminder, telemedicine is medicine. There is no change in the standard of care. The only difference is going to be your limitation in scope, but we can find some creative ways to still get the information that we may need. So just like in a regular office exam, when you're doing an abdominal exam, you're still going to use the same, you're going to follow the same things that you always do. So which are going to be inspection, auscultation, percussion, palpation. So let's kind of talk through each of those and see what we can do as far as on a virtual exam. So with inspection, you can ask the patient if they're comfortable lifting their shirt up so you can visibly inspect to look for things like scars, hernias, any discoloration, bruising, things like that. If it's feasible and the patient can, you can even ask them to lay down when doing an abdominal exam. If they're unable to or are unwilling to do so, that's okay. You just document that and you can even comment on something like their body habitus. Next is going to be auscultation. So for that, if the patient has something like an electronic stethoscope, then you can definitely listen to all four quadrants, listening for bowel sounds. You can even appreciate some aortic bruits or renal bruits if they're able to capture that audio and send it to you. Most patients, if they're at home, probably won't have that, but that's okay. Next is going to be percussion, and you could potentially teach the patient how to percuss in all four quadrants of the abdomen. But truth be told, this can be a little bit challenging because patients may not be able to properly assess between the different sounds and pitches. Next is going to be palpation. Palpation is one that you can definitely ask the patients and walk them through how to do the proper exam. You can even do special tests. So we're going to do one of that together so you can see more of what I mean. But the most important question that I encourage all of my students to ask, and especially in a telehealth exam, is ask the question why. Why are you doing this and what information are you trying to obtain? So let's kind of talk through what that would look like. So I'm going to stand up so that you can see better. But when doing palpation, I ask the patient to find the ribs because that's going to be a very easy landmark for them to find. I ask them to walk their fingers up until it meets in the middle. And now they're at their xiphoid process. Then approximately 1 inch down will be the epigastric area. Next, I'll explain to the patient that we're going to divide the abdomen into 4 quadrants. And oftentimes, I'll stand up just like this so that they can mirror me. I find that it's easier for the patient to follow along. When describing how to do light or deep palpation, I find that the more similes you can use, the better. I often describe it to the patient that it's like kneading dough, and we do a 1- and 2-handed approach for light and deep palpation, respectively. Then, starting with the right upper quadrant, if I'm concerned for something like a cholecystitis, and given their history, I may ask the patient to take a deep breath in and push in to elicit a positive Murphy sign. Remember, I told you to always ask why. Why are you doing this special test? Because if there's an inflamed gallbladder, when you take a deep breath in, the lungs will expand, pushing the liver and the gallbladder downwards a little bit past the rib cage so that when you push in, you'll be able to elicit pain known as a positive Murphy sign. Next, I ask the patient to palpate in the left upper quadrant, probably assessing for something like a splenomegaly. But truth be told, this is a little bit harder to appreciate given the way that the spleen is located. But depending on the patient's history, you'd be able to get any pertinent clues. Next, you're looking at the right lower quadrant for the most common culprit, which is appendicitis. So, if we imagine that we're going to push at the appendix, which is going to be at McBurney's point, which is 2/3 of the way down at a diagonal between the umbilicus and the ASIS. If you were to push over here, you would expect that you would feel pain if this was an inflamed gallbladder, or not gallbladder, an inflamed appendix, excuse me, and this would be a positive McBurney's. If I'm concerned about appendicitis, I may even ask about an Aaron's or Rovsing sign. So a quick reminder, Aaron's sign is going to be pain felt near the epigastric region when pressure is applied at McBurney's point, along with Rovsing is going to be positive when pressure is applied over the left lower quadrant, causing pain in the right lower quadrant. So remember I told you to always ask why? Let's go through a demo so I can show you what this would be. So let's pretend this is the peritoneum on top of the organs. So when you push down, you can appreciate that, but do you see how it's causing a stretch over here? And that's what's going to be causing the discomfort and pain. So you can tell that the common theme here is that if you push and irritate an acutely inflamed organ, it's going to elicit pain. So how can you think outside the box to get some similar information? You could ask the patient to jump. So for my pediatric patients, I'll often ask them if they can do jumping jacks. And this will help me better assess if there's an inflamed organ that by jarring it has now causes pain and will tell me that I probably need to send this patient out to higher level care. Then pushing on the left lower quadrant, most common thing could be probably something like diverticulitis, but again, it's going to be very dependent on the patient history and symptoms. You could, of course, assess for other areas, things like lymphadenopathy, CVA tenderness, if you're concerned about a UTI or pyelo, things like that. So one of the things I always encourage you to ask is, along with the question why, is to make sure that you always explain to the patient what the red flags are. So always go over what red flags to look out for and what and where the patient needs to go if those symptoms are to occur. So I'll share with you a case of a patient that I saw who came in for what I thought, or actually at that time presented just as a simple gastroenteritis. Fast forward a few days, ended up being a bowel obstruction. So when I called the patient back for a care call, he was actually really happy because I went over with him what red flags to look out for and what to do if something like that was to occur. So he knew exactly what to do and where to get appropriate level of care. So I hope that was helpful, and I wish you guys the best. Thanks so much. Have a wonderful day. Bye, VIPs.